Ladies and gentlemen, we are going to look at a program that is being initiated in our primary schools in Uganda, and this program is called mWEL. mWEL in full is promoting mental well-being and empowering lives of the school community. We want to look at the background of how we got into this mWEL program. When we look at the Uganda's education system, we realize that Uganda has a population of over 47 million Ugandans. And Uganda has one of the youngest and most rapidly growing population in the world, with a total fertility rate of each woman having between around 5 births in their lifetime. We also want to remember that Uganda is a low-income country with a capital income of about $1,000. In 1997, the Ministry of Education introduced the universal system of education, in which families would have their children attend school without paying any fees. The enrollment rates went up, but completion of primary school is very low, and only 1 in 4 primary school pupils is able to proceed to secondary school. We have a 7-6-3 year system. So mWEL looked at the reasons for the high dropouts in our universal primary school education. One of them is the lack of money to buy important materials like uniforms, stationery, and textbooks. Then we also are aware that there is violence in the form of caning and other corporal punishments, sexual abuse, with almost 24% of pupils experiencing sexual abuse, which is mostly done in schools and mostly by the teachers who will be protecting these children. We have issues of teacher absenteeism, which is very high. In the research that we conducted, about 60% of teachers in nearly half of Uganda's public schools are not in class when they need to be. And the reasons for this are poor, inadequate facilities. The teachers are overworked and demotivated. And classrooms have so many pupils, often going to 100 pupils, sometimes even more. So the Uganda's education expenditure is very low. We need to remember that. It's about 10%. And this is lower than the average for sub-Saharan Africa, which is put at 16%. It's against this background that we introduced mWEL into the Ugandan schools. We used a task-shifting approach where we trained mental health specialists from Makerere University, and these were trained by our collaborators from New York University. So when this training was over, these mental health specialists then went ahead and trained teachers in 10 primary schools around Kampala district. And then we realized there was a need to also train the teachers, the parents. And so parents were in these schools were also trained in the mWEL program that is about the strategies that teachers can use in the classroom so that they minimize misbehavior of children. So from here, our reports indicate that the teachers are also overwhelmed. Like we've looked at the problems that teachers are facing. They were overwhelmed by the numbers of children in the classrooms. They didn't have adequate materials to facilitate their teaching. They were also lowly paid, and sometimes they found this explains the absenteeism for the teachers. So, looking at the distress that the teachers were going through, we decided that we would come up with a teacher well-being program that would cater for the distress of the teachers. So this one has been tested, and we are beginning to use it and scaling up in different primary schools in the country. Now, the other program that we have apart from the teacher well-being program is a program that looks at strategies that minimize misbehavior in the classroom. It's very interesting, and sometimes these are the things that we do with our children in our homes, but sometimes even in the classrooms. But how do we use them? We have evidence-based research that has supported and facilitated our using these strategies. For example, we have the ABC model, we have the fun skills, we have responsive strategies, we have so many strategies that we train the teachers in to be able to almost effortlessly conduct their classrooms so that the students, the pupils are not distressed, but also the teachers find it a lot easier to conduct their classrooms because they can use these strategies. So we trained the teachers in Kampala district. Then later, around 2019, we expanded and we went to Nakaseke district. So we worked in Nakaseke district, Kampala district, and Hoima district. And the idea was that since we do not have enough mental health specialists that would go around all the schools in the country, we felt that using a task shifting model would be beneficial for us. So when we went out of Kampala district, we trained tutors. We decided to collaborate and work with tutors in core primary teacher colleges. So in here, we went to Hoima Bulera Core PTC. We went to Shiburi Core PTC in Kampala, and then we also went to Nakaseke Core PTC. So using a task shifting model, we decided to train the tutors of the primary school teachers, and we felt that if they could ably train the teachers, then it would be easier for us to spread out the training program to the rest of the country, because that was one of our aims. So we tested out this task shifting model, and actually it worked very well, and we got very good results, and the tutors could ably train the teachers. So we are at a point where we want to do scaling up, and in this scaling up, we are thinking that we can test out and we can further task shift using tutors to train teachers that we are calling peer facilitators. And then these peer facilitators in the primary schools are going to train teachers onto this program. We are working with the Ministry of Education and also the Ministry of Health. We are glad that we can work with you on empowering teachers, but also enhancing the learning of the pupils so that they can live, they can work, they can learn in an environment that is safe, that is nurturing, and that is predictable. Thank you very much.